Operation Granite Shield, an 18-hour enforcement action targeting drug traffickers that resulted in the arrest of 151 people. These are terrible people, and we have to get tough on those people, because we can have all the blue ribbon committees we want, but if we don't get tough on the drug dealers, we're wasting our time. Just remember that. We're wasting our time. And that toughness includes the death penalty.
Good evening and welcome to Metro Focus. I'm Rafael P. Roman. Tough words from President Trump earlier this month in New Hampshire, a state hit hard by the opioid epidemic. Fighting opioid addiction has become one of President Trump's top domestic priorities. The president also feels that building a wall on the Mexican border will stop a large percentage of drugs flowing into this country. The administration has made some inroads in the battle against opioid addiction. It has, for example, made overdose reversal drugs more readily available, has created a database to keep track of patients seeking prescription painkillers, and has also expanded coverage for addiction treatment. In addition, on Tuesday, the DEA announced that it is deploying 250 additional task force officers and dozens of analysts across the country to crack down on the opioid epidemic. Yesterday, the president went on Twitter to make a new announcement regarding the scourge, saying, quote, "I am very pleased to welcome the Opioid Memorial to the President's Park in April. I encourage all to visit and remember those who we have lost to the deadly epidemic. We will keep fighting until we defeat the opioid crisis," unquote. Working with the Department of the Interior, the National Park Service, and the National Safety Council, the Prescribed to Death Memorial will honor the families and victims of the epidemic. The exhibit will run from April 11th until April 18th. Opioid addiction continues to plague the country, leaving death and broken families in its wake, and the statistics are frightening. Heroin-related overdoses have almost quadrupled in the last decade. In fact, in 2016, drug overdoses killed more Americans than the entire Vietnam War. And here in the city, Staten Island is ground zero for heroin addiction. Last year, there were 86 deaths resulting from overdoses, a 26% decrease from the 116 deaths the year before, but still 86 deaths too many. Metro Focus co-host Jack Ford had a chance to speak with Staten Island District Attorney Michael McMahon, and he began the conversation by asking the DA why we are seeing this explosion of heroin addiction leading to so many overdose deaths.
In two words, it seems that heroin has become extremely accessible and acceptable. There's a new generation of drug users who, for some reason, think that heroin is, as I said, acceptable. And it's accessible because it's being sold everywhere. But where it came from, or why it became so widely accepted, is through the pill crisis that we had in the 90s and earlier part of this
Yeah, talk about
century.
that connection between the two.
Sure. So in the mid-90s, the medical community got very, very focused on pain management. And at the same time, Big Pharma started pushing out opioid prescription painkillers like OxyContin, Oxycodone, Hydrocodone, Vicodin. So much so that if you get a tooth pulled, you get 30 of these pills and 90 of these pills. And they would tell people that they're not addictive, and that's actually false. They're extremely, extremely addictive. And so you had a whole swath of this country using these pills without any real control. Last year alone, there were 300 million prescriptions for prescription pain medicine in a country of 300 million people. So the market is awash with these things. So people became addicted. The makeup of these drugs is very similar to heroin. And so the addiction is like heroin. Now, we've cracked down on the use of these pills. And as such, then there became a demand for heroin. The drug dealers picked up on this.
Substitute in some way.
Exactly.
For
the drug dealers picked up on this and flooded the market now with heroin. And so you have the heroin everywhere. It's, as I said, readily accessible. And we have a whole generation of people who think that, you know, when we were young, the notion of using heroin was really foreign. It was taboo. It was, something we wouldn't do.
It was thought to be this bizarre, sort of foreign, dirty type of thing.
Correct.
And you're saying now it's achieved an element of acceptability.
Acceptability. And you mentioned the high number of overdose deaths we've had in Staten Island. They're in homes, in restaurants, in people's cars. So you're right, in the old days it was sort of in the shadows, under train stations, in dark poorly lit neighborhoods now, it's sort of mainstreamed. And so we've got a lot of work to do because, as you said, the spike in deaths nationwide is a national concern. We lose more people in this country today from drug overdoses than automobile deaths and gunshot wounds combined.
That's really frightening.
That's frightening.
And I think a lot of people don't realize that. Why is Staten Island having such a problem?
You know, it's a problem that's affecting the middle class across this country. And Staten Island is the more middle-class portion of New York City, if you will. It's more like the rest of the country. Although there are parts of New Jersey, like Ocean County, Monmouth County, that also fit that description. Colorado, California, New Hampshire.
I grew up in Ocean County. I live in Monmouth County now.
Yep.
And you see these stories constantly, every day in the newspapers about these heroin.
Yep. And so it's sort of a middle-class problem. Staten Island fits that demographic description more perhaps than the rest of the city of New York. Also, you know, it's collectively, Staten Island has suffered some traumas from 9/11, hit Staten Island very, very hard. 10% of the people who were lost came from Staten Island, although we're less than 2% of the metropolitan region's population. And then we had Hurricane Sandy as well. So two traumatic events that hit the community collectively. And if you look at other communities across the country, sometimes it's the loss of a factory, the failing of a certain industry, natural disasters. Quite often, when you combine that with that middle-class demographic, access to money, it's a fairly well-to-do community overall, and also access to health insurance. So people start with the pills, then first legal pills, then illegal pills, and then they move to heroin.
So this sort of intertwining of so many of these social factors, and cultural factors.
And then one other factor we have to mention too, Jack, is that what's being sold on the street today is extremely potent. So the purity of the heroin is 60 to 70%, whereby in the old days, in the 80s, let's say the last crisis, it was more like 15 or 20%. And the drug dealers are mixing the heroin with other substances like fentanyl, which is a synthetic heroin, as well as users mix it with Xanax or cocaine to try to increase the high, if you will, a very dangerous activity.
We've heard stories about people who had gotten off it for a while, probably when it was about 20% pure,
right,
and then come back on it, not realizing that it's not getting stepped on as many times.
Correct.
It's much more pure. And all of a sudden, they start shooting something that's now 60 or 70% pure.
Right.
And you have a death.
And you have a death. That's right. So that one shot. And so what we're trying to do is get that message out to people that even one shot, A, will get you hooked, and B, could kill you. So we're trying to do prevention.
Let me talk about some of the other things you're doing in your office. You created an overdose response initiative.
When I took office, right around the corner from me, a young man died. He collapsed on the front lawn of his parents' home, and he passed away, sadly. So when I came into office, I said, let me see the investigation on that case. I want to, see what happened and also see what's happening on the island. And there was no investigation. The way these cases were treated was they would just close out, because if it was a self-inflicted death, if you will, from a drug overdose, the police were not investigating.
So they weren't looking where it came from, who was providing, any of that stuff.
Exactly.
An overdose.
And also from the public health point of view, people were not tracking the deaths, because we realized, as someone who was in the community, boy around the corner, up around the block, pick up the newspaper, another 23-year-old dies at home, no explanation. There was a sense in the community that the numbers were much higher than we were getting from the health department. So we sat down with the police department and came up with what we call the Overdose Response Initiative, where we treat each and every overdose like a crime scene. So we do a forensic investigation. We get the cell phone and download it and try to get the numbers to try to investigate where the drugs were coming from, to track the dealers, because we have to go after the source and we want to lock up the dealers, no question about it. But then we also sit with the families and make sure that they have bereavement counseling and try to see the connections amongst all the young people, how they're interacting and how they're dealing. So it's important to investigate it as the crime that it is, but it's also important that we know exactly how many deaths we've had. And as you mentioned, shockingly, we're close to 80 deaths now on Staten Island just since January 1st, since we started tracking. So knowing those numbers has helped me convince the City Hall to send more police out to Staten Island, to increase the budget of my office so we have more tools to fight this crisis. So it's helped us in many ways, but first and foremost to know what's happened, and B, also how to take down the dealers. And with the information that we've gotten from some investigations, we've been able to put together 2 pretty significant takedowns of the dealers. And at the same time, we're working with people to get the treatment they need for the people who are addicted.
And that's important. I think your office is doing a wonderful job on both ends, as you said, helping the family members and helping people who are addicted, and then tracking down the criminal end of this thing.
Right.
Mike, thanks for spending some time with us.
Thanks so
and
much.
hopefully we can talk some more down the road and see how this is all going.
I look forward to it, and thanks for helping us get the word out on this very important issue.
You be well. And for more information on the heroin crisis gripping our area, or if you or someone you know is looking for help in dealing with an addiction, make sure you visit us online at metrofocus.org.